Hello again, everyone. It's great to see that you were able to join us, despite the current situation where many of you might have challenges with internet connectivity, and also all of you in Asia. This is not for all of you, it's not a very convenient time. So thank you for making yourself available for this call in the late afternoon or evening. I hope you're all doing well, and I hope your families and friends are also all okay, despite the situation we're currently in. As we have been sharing in emails with you over the last, so let me also suggest that everyone who's not talking mutes themselves. So if you can mute yourself, that would be great. That would make it easier for everyone else to hear. There is someone who wants to comment.
Hello, Vibeke.
How are you? Can you hear us?
I hear you. Do you hear me?
Yes, we do. Thank you. So yes, thank you everyone for joining us. We have a good mixture of countries represented here, and then that we're glad to hear. There's also some of the countries who specified to us that they would unfortunately not be very available for the call, but we will set up separate calls, and we can also do that with you following this overall information sharing. Maybe Faryal, you could move on to the next slide. So as you have been seeing from all the emails we have sent to you in the last week and two, we expect travel restrictions to be in place for a longer period of time, and we therefore think that it will be difficult to provide support in country or in person for quite a few months to come. It's very difficult to say at the moment for how long this will last. And we therefore want to try and support you as much as possible remotely. And we are currently learning ourselves how to try and run webinars and workshops and different kinds of exchange online. And this is one of the methods that we have is running a webinar, and we will try and make this webinar as interactive as possible with polls and having you all also provide input and comments. I also mentioned to you in one of the emails that the project is also going through a restructuring. We've been in conversations with DFID about restructuring the project so that it also covers COVID-19 response. So not only SDG work, but also COVID-19 response. And part of this work or this webinar will be covering also that, trying to understand better from you what you're currently doing in related to data response to COVID-19, what potential plans are, what your needs might be, etc. But DFID, as they are in a difficult economic situation at the moment as well, have also asked us to cut the project. So the project will be a bit smaller than it has been. That will mainly, I think, affect travel, but it will also affect some of the funds that we can transfer to you. So the money transfer will, at least to some extent, be a little bit smaller than we had intentionally planned. Exactly what it will look like is not something we know at the moment. We're still waiting for a final feedback from DFID on the revised proposal that we had sent to them. But we will keep you all informed as soon as we get more information. And our main focal point that DFID is also joining the call, so maybe he is able to tell us something at present. If not, we can also give it. We will come back to you at a later stage. So this was, yeah, go ahead, Ian.
Yeah, sorry. Yeah, happy to kind of say something. I mean, I think as you've kind of set out there, it's very difficult for DFID at the minute, given kind of not just where we are in terms of the COVID response, but also where the UK has been in terms of changing governments and really trying to get ourselves to a position where we understand what the kind of government finance is going to be over the next few years. And I think that combined with the COVID-19 has kind of left us in quite a difficult position, I think, and somewhere where we don't really know what's going to happen over the next few years. But I think what we're trying to do at the minute is get ourselves to a position where we can have some flexibility in the approaches to the programs and learn as much as we can from the COVID response so that we can adjust the programs to kind of best make use of the resources that we've got, of the limited resources that we've got. So I think that's kind of where the request has come from, really, that we know we're going to need to try and cut the programs to free up more resources to support COVID response, but we want to do it in such a way that kind of best makes use of the funding that is available, make sure that we can still kind of deliver impact as far as possible. And I think that certainly the conversations we've had on restructuring the program, I think are moving in the right direction.
Thank you very much, Ian. So we will, of course, also update everyone as soon as we get more input and we know what it's going to look like more concretely. But I think what is clear is that the project will not stop entirely, and we will continue working with you both on SDG monitoring implementation, and we are also available to support you on the COVID response. And remote support is cheap in the sense that we can sit in each of our offices or each of our homes and support you based on the needs. And this is something we can come back to also on bilateral calls, what specifically you would need, especially those of you where we also have some local funding available. Maybe there are some elements that should be adjusted to also respond to the COVID-19 situation. So just to summarize, what we're trying to do with this webinar is to get an overview of your current work arrangement so that we understand better what positions you are in and to what extent you will be able to work with us remotely at present and in the near future. We also would like to need to know more about your need for support on broader COVID-19 response and SDG-related need in light of the COVID-19 restrictions. So with that, I want to also hand over the word to Daniel, who's, I think many of you know, who's part of the UNSD DFID project team. He will give you an overview of some of the tools and guidance that we have developed in the last couple of weeks. And I think, yeah, Daniel, you can introduce more yourself. Sorry.
Thank you,
yeah,
Rebecca.
sorry,
Yeah.
Daniel. There was actually one thing that we wanted to test. Actually, we are going to run a lot of polls at this webinar, and we wanted to start with a little bit of a fun poll. So for those of you who have computers, you will see the poll being presented very soon now at the bottom right of your screen. So the question we currently have is, what superpower would you most like to have? Super strength, flying, invisibility, teleportation, or mind reading? So you can cross for one of them, and then when the poll is submitted, and when the poll is over, you will see what the majority has chosen. And we will use this tool throughout the webinar. So this is a little bit to kind of start up a bit fun, and also to see if it's working for you all. So if you have any challenges, also let us know in the chat. On the phone, it should also be available to see and to provide input. So when we are all done specifying what our our priority is, or what our preferred superpower would be, Fariel will show us the polling results. And while we are also waiting for the result, what I can let you know is that we also have the chat option. So if you have any questions that come up along the way that might not be relevant for the specific topic, if there are things that are unclear, if you can't hear, if there's something specific, you can just send a message to everyone or to the DESA2 WebEx host or to me, and then we can bring it up in the webinar as we move along. And I see we now have the results. There is a tie between the, now I actually can't see what the first one is, between teleportation and the superpowers. So that's it's good to see. We got quite a few responses. And for the others, we can see for the next poll, and the poll would be following Daniel's presentation about the COVID-19 response tools that UNSD currently has developed. Over to you, Daniel.
Thank you, Vibeke. Good morning, good afternoon, everyone. Good to see a good number of turnouts for our first webinar. I'll proceed with my presentation. Is my screen visible?
No, it's not. I think now we see number 2.
Okay.
Yeah.
Thank you. So in this section of the presentation, I'll be focusing on what the UNSD in general is doing to the COVID-19 response. And there are particularly two items that I wanted to go through. The first one is what we call the COVID-19 response website, which was launched in partnership with 2 of our partners, Global Partnership for Sustainable Development and Open Data Watch. So this initiative mainly focuses on providing a dedicated website that provides resources, guidance, tools, and best practices, mainly geared towards the national statistical offices. So a lot of COVID response websites are coming up. This in particular is dedicated to share tools, experiences, and guidance specific to the National Statistics Office across our global community, across the world. And it's not only UNSD who is providing support in this. We have 2 other strong partners who also are putting their resources in place to support. To be specific, one of the key things that we wanted to address in this is issues related to managerial and IT challenges for operational continuity. So how do we continue in this environment? We're changing very rapidly from traditional to more on a remote kind of working environment, which would bring its own challenges. And the key infrastructure here is IT, and then we wanted to share resources available in this area and see what others are doing, and how NSOs can also pick some of the brains from what has been working so far in other areas. This has been going on in some, especially in the IT world. A lot of remote working environments have been set up, has been working even before COVID. So how do we kind of make capitalization of those experiences? That's one section that the website focuses. The other one is to provide data solutions that are specifically geared to monitoring the impact of COVID. This deals with tracing the progress of the virus in a specific country, looking to the impacts that's happening because of it, be it economical, health, infrastructure. All those things could be also discussed in this area, and then we're asking partners and others share solutions that are coming out, and there are a lot of data solutions being provided. So we're trying to make sure that we keep certain data solutions that we think are useful for the national statistical offices across the globe. The other focus on this is we have Open Data Watch, which is another partner who also is kind of an advocate for open data, as the name indicates. And we're looking into open data solutions, especially to the COVID-19 response. I mean, this has been an ongoing discussion in the Statistical Commission. And now with COVID-19 being severely impacting the normal day-to-day working environment, opening data in an environment which is suitable for working and producing results from your offices might be crucial than being a wish to have or something that we would be proud of being open. But this is a time now also to make sure that your data is open and could be used as everybody is not in the office, and there are people who are trying to get resources and maybe even give the opportunity for NSOs to share their contribution to the COVID-19 response, because there's a lot of data sets, thematic areas that you can open up for this response. And the last one, which is more than the action items, is opening dialogues, trying to bring on people who would provide some kind of support by providing a web space to discuss on the progress and support in this area. There are two specific things I wanted to highlight in this website. We have a dedicated hotline. So we have this COVID-19.stat@un.org. This is a dedicated email address that we are monitoring at UNSD. If there are very specific things related to COVID-19 you wanted to share to the world, or if there are specific questions that you wanted us to follow up, this is where you send your requests and also contributions. So that's something that we also highlight your work. I have been going through all the DFID country office websites to see what is happening in COVID-19. And some of you have already been doing a lot in this short period of time and putting up some products. We wanted to also proactively follow up with you in getting those good works out to the rest of the national statistical community. But also we are open to support areas, as Rebecca was introducing, specifically on UNSD DFID project countries, specifically work on supporting you on this COVID-19 response. Now, DFID, our development partner, is also pushing our team to work very closely with NSOs regarding COVID-19 response. This is where we pick up your requests and then also pick up your contribution and also highlight it in the COVID-19 response website. The other section, which is what we are doing right now, is organizing virtual events. This is one of the events we're organizing specifically for UNSD DFID countries, but we're also organizing an open global event. The first one happened a week ago on a Twitter chat, which we would be also continuing to do regularly. And you could see a snippet of the screenshot of the Twitter chat thread. We have a blog post about this Twitter chat that you'll see more detail when I just show the website. There was last week also another webinar. It's not only UNSD who is providing these virtual events, we also share whatever is going on in our community. Paris 21 also had a webinar last week on addressing COVID-19, specifically geared to low and middle income countries in that area. So we are actively going to maintain these virtual events and also kind of advocate broadcast whenever they are available. So we're trying to work with our partners in providing you as much resources as possible so that you can attain virtually. The next one, I'll just go to the slides and go back to the website and show you what we have. The next section that we are focusing on providing what we call a response, a COVID-19 response website and data hub. This in particular for our national statistical offices is something that we wanted to push a bit further in getting their data exposed to the response of COVID-19. What do we mean by that? So we're trying to use what we have been using in SDGs on the Federated Information System. You might have, some of you have also been participating in this or even using the product itself. This is a platform that we put out with our partner ISRI, which they officially launched their support in COVID-19 to provide licenses and resources for their cloud implementation. So our big commitment here is to make sure that we provide at least a specific thematic area data sets that come from different sources and mainly from the national statistical systems in these 4 thematic areas. There was a discussion that was happening with the response COVID-19 response working group at the UNSD and our partners, identifying what are the areas which are in immediate need. From our quick assessment, these are the 4 areas that were identified. One is data on COVID-19. This is what we call more of a virus tracking data sets. The second one is data sets related to healthcare resources. The third one is data on economy, which is related to the impact of the COVID-19. And the last item is the population, which is which population is being targeted. That's the area where you get the economical impact overlaid on population data sets. So what are the 3 things what we wanted to highlight from this data hub? The first one is we have in partnership with ISRI are putting together this COVID-19 data hubs, which is using a cloud infrastructure, infrastructure that is being provided by ISRI. It uses a WebGIS technology, so the data set that you have would be merged with some geographic components, so that whenever you have a data that you wanted to share and display, that would be tied to a geographic reference. So naturally, geocoded data set with your statistical data set come to light. The reason being this crisis in a way kind of warranties that you need to know where things are happening, and that's where the WebGIS technology comes really in and pretty handy when you wanted to pass your message in these 4 thematic areas. And they also provided ready-to-use templates that you can put up quickly. There is some work to it, but relatively speaking, you can put up COVID-19 open data sites very quickly. I'll show you how it looks. We also have Ghana in the call who have done this. We also have Myanmar who also did something similar using this, and others also in the list have putting some COVID-19 response data and visualizations. But we'll try to showcase what we have done and a couple of countries who have used these tools. So I'm just taking a screenshot of what we have. So what happens is whenever you put together your data sources, you are the owners of the data sources, but you kind of share it to the global data hub, which we call, in other terms, federate your data sets to the global hub so that your data sets related to COVID-19 in terms of economy, health, infrastructure, our population could be shared with other NA sources. So you can kind of use these data resources from others and yours also to see trends, to do analysis, to put out some visualization and maybe like analysis ready products using this. I'll now just switch to the website. Bear with me when I share. Now you should see the website now. So this is our COVID-19 data website. So as I was explaining, we have different sections in this page. So the first section focuses, I'll come back to the first section, but the second section focuses on our multi-stakeholder collaborative DFID, which is the website for the response website. So if you look into this, we have 6 thematic areas, 6 areas where we focus on delivering information. So I was looking at the sharing experience. If you see in my last slide, this is where we're providing specific webinars, virtual events, Twitter chats. If you look into our Twitter chat details, this happened in April, 1st April. So you see that we're throwing out the different chat questions to the global community and then see what people are thinking, responding. And I have also seen the thread that some of you already participated, who are already in the call. The idea is to get started with a specific set of questions and do these Twitter chats as often as possible to support you and see what is happening outside of your environment. We have also blogs that are coming with the open data site and then share experience, and there are areas in working remotely. And also, these are all blog posts, and we are open also to, if you remember, we have this dedicated hotline. So we would like, if you have something to share, we could also highlight your work and share it with the rest of the national statistical and the global statistical community. So if we come back to the data hub that I was mentioning, so these are the 4 thematic areas I'll go to the first one, which just gives you an idea of what it is. These are data sets related to COVID-19 response. If you look into, so we have data sets from our statistics division. We're putting some data sets from our annual yearbook into this, which is geocoded, so you can use it for, I'll show you one example later on. We have, this is the famous John Hopkins data sets coming out of John Hopkins. So we also, they have also federated their content, so pull statistics from here. We have also Statistics Ghana sharing information. We have data sets from Canada. We're also putting data sets related to COVID. So if I go back and show you another one.
You need to start wrapping up, Daniel, yes. So just the key messages. Thank you.
Good. So what happens is we have these data sets and we are pulling them into producing products. So this is one data set. If you see this data set, this is a section where it is reading data provided by John Hopkins on the COVID-19 response. So we are not maintaining this, but this was federated. So So we're all able to produce a visualization out of it. And we're also featuring different featured data sets, featured hubs here. So you see the one from Myanmar, you see the one from Ghana, you see the one from Canada. And so this is like an aggregation of what's happening, and then we're featuring those products that are being useful. The UNFPA put out their census status by country. This is something that we're also highlighting. So this is the data hub, and we wanted to mainly focus on, as long as you have data set that you can use with COVID-19 response, we can work with you in putting something similar like this, as a couple of countries have already done this. So that's to give you a highlight, but we'll follow up with questions, and then if there are any additional follow-ups, please let us know in the chat. Thank you, Vibeke.
Thank you, Daniel. I hope this was useful to you all. And as Daniel said, either send us comments in the chat, or you can also write to us afterwards, of course, if you find this interesting and you would like to see how that could be relevant in your context. And of course, the COVID response page is always available if you want to check up information. And also let us know if you think there's information missing, then we can try and find more out about that specifically and try and add it to the response page. We're now moving to the third part of our webinar, and we have packed it with quite a lot of information, but it's also information for us. And then this third part is kind of for us to try and understand what your current situation is. And we'll again start with the poll. As you can see, we've been trying to understand to ourselves what will be the most challenging situation. And obviously that is working from home. And for many of you, there might be challenges with internet access to systems and service, etc. And we just posted 2 questions in the polling. One is whether your the staff of your organization is still attending the office, or whether staff in your office is now working remotely. Of course, you might have some mixture of situations. So then choose the one that is kind of closest to the fact. If you're still able to attend the office to some extent, then and meet up, then maybe you could choose that one, for instance. And then, especially for those of you working remotely, but also those who might do in the future, the second question is, do you have systems in place for working from home? Or do you have, if you don't have, do you have plans for that moving forward? And the reason why we're asking that question is because we know that some of your offices have been in the process, because no one has really ever worked from home before. So it's really a big change and a big chunk of work to try and understand how you could do it, make it work, how you can find laptops for those who need to work remotely, provide internet, etc. So we're just trying to get a better understanding of that. There will be more questions also coming. So please respond to those 2, and then we will see the poll and we will move on to the next questions.
Okay, I have a question.
Go ahead.
Hello?
Yes.
I have a question. This is a Tamboyo.
Yes, go ahead, Tamboyo.
Okay, on the first one, are staff in your organization working from home or remotely? We have 2 scenarios here. Some people are working from home and some of us are at the office, so I don't know.
Yeah, so it's a mixture.
Yeah.
Yeah, that's what I understood. And the ones working in the office, are those kind of still the key staff, for instance?
Yeah.
Hello?
Yeah. Hello, yes.
Can you hear me?
We can.
Yeah, I'm the Dr. Gassim from Jordan.
Okay.
Hello.
Viveka, hi everyone. Just it's a challenge for us these times, how to manage the statistic system at this difficult, because most of the staff now at home and they are in different governorates. It's difficult to contact with them, and we get we are not ready for such kind of crisis. Therefore, we are maintaining some of the statistics, but how to maintain all the statistics and to continue. And for example, the labor market, the national account, we need data from the field, how to deal with those, how we can make some adjustment. What's your suggestion how to deal with the prices? We usually used to go to field work. Now there is no field work to work even to have the data. Then it become more easy. But how to compensate for the data? How to have to continue doing the same business? Also, we have interest in having the dashboard for what is the source for the data, how to incorporate the data in our data, for example, in Jordan, to be within dashboard, how we can follow up those cases has been affected, or those possible persons that will be affected in the second stage or the third stage. This is the challenge for us. We need some clarification from your perspective and from my colleagues in different countries, how to overcome this challenge that we are facing at the national statistics.
Thank you very much. I think what you're voicing is something we've also heard from other offices. Some have already started work on this, and we'll see, for instance, Ghana's presentation a little bit later. And there is also some information on how offices have responded to this on the COVID-19 response page that Daniel provided. But we can have a separate follow-up call to see how we best can support you and provide you concrete input as part of the project. And thank you again very much for sharing. It's useful for us to understand these aspects.
Viveka, because there is a high demand at this time from different organizations. The crisis, the management of the crisis, they want to have the source of the food, how sufficient the export, import of food, how we can compensate, also how to have assess the impact of to have assessment for the economic situation and how long is the crisis will be. This easy question we need an answer, because there is a high demand for who or organizations that should be open, who should be in the first stage, in the second stage. These things we need an answer, and from the international perspective. And we have a challenge at statistics system, facing challenge not in my country but in other countries, and they're calling me different countries, what you did, how we can do this. We need something that can be a sample for the country, how to deal with the data and the effects of the data, the assessment of the data, how we can be at this time helpful in.
So we can give you some concrete examples from the COVID-19 response page. There is something there also online what concrete countries are doing. But what we also I think or have been thinking of is to kind of continue this series of WebEx meetings where you also can share more experiences across countries, how you're responding to the different challenges. Uganda is not here today in the call, I think, but we know, for instance, that they also have been challenged with some of the same things. They're now trying to get Zoom licenses for staff, trying to secure internet, and also trying to see how to work across government agencies. And I think for that, trying to share phone lists or share private contact information if the work email doesn't work, etc., could be options in that regard. And we would also be happy to continue running or having calls with you to try and provide input. As we also wrote in the email, we can provide remote workshops for staff who has access. both related to COVID-19, but also linked to, and that is also naturally linked to SDGs, right? Because a lot of the SDGs also have an economic impact or aspect. So we can follow up individually on the concrete challenges that you're facing. What we're trying to currently in this webinar is to try and understand the kind of the width of the challenges and where it is. So maybe we could set up the second part of the poll, which is more focused on internet access to servers and systems, because we know that this is a challenge also in many countries with the access to the servers and systems where you would have all the data, the old data. It's very understandable, of course, that it's not possible now to run surveys and censuses in the field. But even having access to all data might be a challenge. So,
Hello?
yes.
Yeah, this is Ivan Morenzi, the Deputy Director General of Statistics Office Rwanda. I just wanted to share our experience.
Please go ahead.
Yeah, I think this situation with the lockdown, and then maybe the lockdown varies in different countries, but in the context of Kigali, Rwanda, it is a real lockdown where we are not allowed to go to offices, and therefore what we've tried to do is to see that all the key staff have access to internet. And as you can imagine, the quality of internet also varies. And at least we've tried to ensure that staff have internet at home, modems, and we've subscribed to WebEx. So this system we are using to help us keep in touch and connection. Our focus for now for staff is more of the analysis of data we have been having, or the data we recently collected, or a bit of training to engage staff in renewing and refreshing themselves with various skills, and encourage others actually also to take leave because they realize they're going to be working. So that's how we are trying to manage. For those key staff who we obviously realize to be working on things, is to ensure they have the internet and keep in touch by WebEx. Every day we have, let's say, 2 to 3 discussions on different things. But also for other staff, assign them some things that they need to be reading or reviewing as a way to refresh themselves, whereas others also encourage them to take their leave. As of now, that's what we are doing. As with respect to COVID, the statistics office is not really very involved monitoring things. It's mainly the Ministry of Health, and we have not at all been brought on board on tracking anything, and so we have rarely done anything on that. So I was just looking forward to hear what other pieces maybe.
Thank you very much. That's also useful to hear, and maybe that is actually a better approach to hear from you directly rather than trying to get it from the polls, because we see that many of you are maybe not so familiar with the polling system. So if we have another one who wants to share experiences from their country, we could take one more, and then we could move on to the next piece.
Hello.
Yes, hello.
Can I take the floor? I'm Abarash from Ethiopia.
Yes, please go ahead.
Okay, so thank you very much. In our office, it's almost similar to the others. Most of our staffs are working from home, and only basically the management and heads of department and senior key staffs are coming to office. But most staffs are working from home, and they normally use different internet connections to send and to communicate each other. So we are, for the time being, we have stopped almost all surveys except CTI. And for the other surveys, which the data is already collected, the experts are working on the report writing and report preparation. But otherwise, other office works are almost stopped. So that's where we are. And in the future, we are thinking of how we can facilitate a better communication. Thank you.
Thank you very much, Abrash. That's also useful. We have one last polling question that I also wanted to put out here. We heard from you in Rwanda that you also use WebEx, but we are interested to see what the preferred tools or collaboration platforms are. So if you all could put in your response, that would be great. We hear that many of you have challenges with internet, with also involving staff who are working or not working from home. So we would be happy also to try and sort out how we could support some of that, how we could. I know you mentioned training, Ivan, so maybe, for instance, part of the training could also be that we run workshops with you. Our team, for instance, has experience when it comes to running data modeling workshops remotely. That is something we could do. We could do follow-up trainings on metadata for the SDGs. We could also look at potential other elements and set up either webinars or more concrete trainings. I know, for instance, some countries are now moving in the direction of doing telephone interviewing. Of course, you would need equipment, but if something along those lines is in place, we could run something specifically on that topic for you. So this is really just a first meeting to try and get a better understanding of what everyone is up to and what the potentials are. So we'll soon have the result from the poll. And following that, we have changed the order a little bit of this webinar, as I think it would be very useful to hear from Omar from Ghana and what they have been doing. Because they have already set up a COVID-19 response page, as Daniel was also showcasing a bit earlier from our view. And then following that, we will Daniel will also show a few other examples, and we'll come back to the SDG and the overall collaboration part towards the end. I see that Zoom and WebEx are the most preferred tools here, and Skype. So that's interesting and useful to know. Those are also among the tools that we are mainly using. We also have the one response on Facebook here, which is interesting. We heard that, for instance, the African Development Bank is going to use that one. So maybe that's also something to look at. Okay, thank you very much. I'd then like to hand over to you, Omar, so you can share your experience and what you have been doing in Ghana.
Thank you very much, Viveka, and thank you all for being on this call. In the case of Ghana, we had the first case of the coronavirus on the 12th of March. And at that point, the GSS had to react in that we were fortunate to already have a program currently underway that is looking at the use of CDR to support the country's interventions around communicable diseases and around the use for disaster management. So quickly on the 14th, I reached out to Flow Minder to understand how we could use this project to support the country in this area. So we quickly set up calls with Vodafone Ghana, Flow Minder, GSS and we discuss this further. Then the next thing is for me to seek permission from my boss to go ahead with this because I needed to get that institutional buy-in. So thankfully, my boss was fully in support of it, and so we moved the process forward. And within a week, we were able, because on the 16th, the president had given initial indication of mobility restrictions, closing down schools and asking that there are no gatherings beyond 25 people. So we did analysis to cover a period from early February to have an idea of the normal pattern, and then the first week of the mobility restrictions from the 16th of March to 22nd of March. And that gave some interesting outputs. And if you go to the GSS website here and you go through this, you would see some of these initial outputs that I wouldn't want to go into the details, but you can go there to check it up later. And so this initial output, I requested for a meeting with the Minister for Planning, who we share with, and he immediately put us in touch with the Minister for Health. Because the COVID response team, the National Statistical Office was not directly included in that. But given this, he put us directly in touch with the Minister for Health, and we had some initial engagement. But it was a Saturday. I called my boss from home, and he willingly drove in and joined us in a meeting with the Minister for Health and his team. And that was the first eye-opener for them to understand how GSS could support this process. And so we...
Omar, sorry to interrupt you, but your screen is black. So if you're trying to share something, please try another way of showing. I'm sorry for interrupting you in the middle. It's very interesting.
Yeah. Okay, so I'm not too sure. Okay, if it's coming. I don't know if I'm okay. Share. Okay, good. Sorry, this is not what I'm sharing. Okay, so can you see my screen now?
Oh, we still only see black. We see a mouse moving around, but that's it. And now we see an Excel table.
Oh, that's not an Excel table. I'm trying to share. Let me close that one. Sorry.
Now we see your Excel specifics, but the rest is still black.
Okay, so do you see the GSS website now?
No, we still don't.
Oh my goodness. Let me see. I'm sure probably I'm not doing something right. Okay, so let me go back and start sharing.
Now we see a presentation from... Yeah, now you're starting to share it, saying.
Okay.
But it's still black. And now we do. Great. Thank you. Sorry.
Okay. Thank you. All right. So as I mentioned earlier, so if you go through the GSS website, you come to this menu item, you can see here we have mobility analysis, we have the monitoring dashboard, and info hub. Yeah. So we had the engagement with the Ministry of Health, and we were able to put out this then. Once they identified that there's something we could do to support, they provided us passes because at that time the lockdown had started and people were not expected to go to work. But they provided with some passes, which I shared with some of my colleagues who I work with around this. So with that engagement, then we realized that the Ministry of Health, besides the COVID, the mobility analysis, that showed how people were responding to the government directive on not moving around, we realized that the Ministry of Health also had a dashboard, their website they're using to show the COVID details in the country. And we realized there were some deficiencies around that, because because it basically was giving information, aggregated information. If you can see this one now that I've shown, can you see it? This is the Ministry of Health website. Rebecca, is it visible?
Yes, it is. Thank you.
Okay. So you will realize that in the Ministry of Health website, they provide the total number of cases, and then they provide some other listen at the left side here that give indication of how many confirmed cases, the recovered people, and all that. Then we see that initially there were no even graphs as we have now. Then we realized that that's not happy, and the population began to ask a lot of questions. They are not telling us who the people are, where they are located, and any other information that can help us understand the magnitude of the problem in the country. So quickly, I touched base with a few colleagues who had GIS expertise, and then asked them what we could do to help in this case. And they offered to support this initiative by designing this web page that we initially had. But unfortunately, at the time, we did not have access to the ArcGIS enterprise dashboard. So I quickly fell on the network we had, especially with GPSDD and Esri. And Esri, within a space of 5 days, of 3 days, were able to give us free access to their ArcGIS enterprise platform to develop this. And what is very important about this dashboard, which you can go in later on to check, is that for each case and as much information as we have, we try to provide it the geolocation of that. And if, for instance, you click on any case like what I have just done for Accra, you will see for each of the cases we have in Accra, try to move this away. And then, okay, for like this, we have 506 cases in Accra. So all the 506 cases, you click on it, it will give you some basic information on that person. And this second one, for instance, the person, in this case, they have provided information on the age of the person, the sex of the person, and whether the person traveled in from another country or it's from the local surveillance. You can see that this person traveled in from Amsterdam, and the first time it was confirmed. And so we provided all this information across the country that makes people understand the spread of the cases in the country. Beyond this, we also realize that as a National Statistical Office, we are sitting on a lot of data that can provide additional insight for the country. So what we quickly did is to compute many other indicators. As you can see, this is the district population density going to the 271 statistical districts in the country to give a sense of the density, and in many cases where this is the proportion of population who are 60 years and above. And many others, this is average household size. And one of the important ones is here. We try to combine the most recent survey data where we ask wash questions. We ask questions about hand washing practices. And households that indicated they have no water for hand washing. And the next is those that indicated they have no soap for hand washing. And we thought it was important to provide this at the disaggregated level to give local authorities an indication of where they need to focus on this kind of policies that will provide water and other education to people who need it. So these are the immediate things that we did. And so putting this out there has been very important and showing that the National Statistical Office can actually move in, even if nobody initially thought that you have some potential to contribute to the process. Going your way to do that was very important. The next stage of activities that we have been doing that have been very instructive is to make sure that we remotely hold press releases and provide information out there to the media, and they take it out. And people understand that, okay, the National Statistical Office is also supporting with these activities. As we speak now, the GSS immediately developed what we call a business continuity plan to allow our staff to appreciate all the things that we need to continue working on and the things that we have to put on hold at this point. And as we speak, last week, management again came up with a work from home policy that has been shared with all staff for staff to understand how they can work remotely from home on all those areas we have agreed we need to work on. Beyond this, we are currently working on 3 assessments, the socioeconomic impact assessment of COVID-19, and 3 trackers have currently been worked on. One, as Daniel mentioned earlier, one on business, and that basically is speaking. I've just shared just a brief part of this concept note. You can see, can you see this now? This is one of the concept notes I'm working on, and it's showing the 3 tracks that we're working on now. The business track has been rolled out already and is seeking to provide information on performance of businesses, innovative actions being taken to mitigate the impact now and after the pandemic. Then the other track is the local economy track, which seeks to gather data on development of the national economy using price data and exchange rates. And the third track, which I am directly responsible for, is the household and jobs track. This is currently being developed to provide insights from households on how their lives are being impacted, their jobs are being impacted, and their coping mechanisms. And as we speak, we have not completed, but we already working with some partners who have shown extreme support for this. And we intend to use telephone interviews and take a subsample from our leading standard survey to do this work. And this is the first time we will be doing that. And of course, towards the end, I will request that whatever support you can provide to us in respect to conducting telephone interviews, and especially that we want to be doing it remotely, that is very important. So all these activities are currently ongoing, and we have also made sure that some of our activities, we have tried to look at how can we work outside the office space. For instance, we were piloting 2 citizen-generated projects, and that we're at a point where we're going to converge with developers for them to develop applications that will be deployed. And we have gone through the first phase of the design thinking process. The second phase was for the developers to come back and pitch to us their understanding of the problem, and that's when the lockdown started. But we found innovative ways to proceed with that. We have made them work on it remotely, and they have shared their PowerPoint with VoiceOver, and we have shared the links to all the judges and the stakeholders to review and give feedback, and then we go back to them. So we have found ways to continue all these activities remotely. So I would not want to take so much of the time, but 3 key things that we have seen as a strength in this has been what I would call the super motivation to contribute. And this is something that you would need to have to understand that whatever it is, the National Statistical Office has a role to play. The second strength has been strong leadership from the National Statistical Office. Getting the buy-in from the top management of the institution in doing this has been very instructive for me, and that has actually pushed us to what we are doing now. The third thing is leveraging the network you have already built and the partnerships you have around has been very crucial. For instance, we couldn't have gotten access to the Esri platform if we did not have that kind of network already. And that has been very important. Freedom has also come on board to support us with some data analytics that has made it possible for us to put out quite a number of things. And the fourth thing has been being able to have some resources to work from home. And that obviously was not something we envisioned. So it's been a bit of a challenge. And so I'll identify these as the key challenges that have been that we have encountered within this short space in trying to do the work we are doing. So this concept note, we are still in the development, but just a few minutes ago, I received a mail from one of the partners we discussed the questionnaire with yesterday, who are willing to provide over $40,000 for us to proceed with this household and job tracker. And the idea is for us to be able to put out something out in the next 2 weeks initially. We're looking at safety nets, we're looking at coping mechanism, We're looking at subjective well-being, food insecurity, income loss, employment, among others. So these are the basic areas that we are working on at this point. So for us in Ghana, we want to continue to learn from the best practices, and we are happy that you direct you for this opportunity. We're also learning many other things that we are able to do from this particular engagement, and we hope you continue to share with us things that we can do to make this a success. At this point, I would want to pause, and then maybe we may have some discussions along the line. Thank you.
Thank you very much, Omar. I think this is really amazing what you have been doing in this short period of time. We had some challenges with the screen sharing, and we didn't see your last materials now. So I'm wondering, maybe you could share it with us after, both the link to the page and also the Word document that you mentioned, and then we can share it with the whole group, because I think there was a lot of interest here from the other countries. And to be honest, I also got quite inspired by some of the things that you said on how you, for instance, have been working with trying to also engage the line ministries and kind of doing this voiceover and sharing materials that way. I think that could be probably something very interesting for others to do as well. And I think we already mentioned the COVID-19 response page, but currently we do not have too much experience or information on what you and other countries are doing. So it would be very nice for us and for everyone also to share your experiences, both from you in Ghana, but also from other countries in this project. So maybe we could ask you all to share some key information with us on how you're responding to this, what your plans are, so that we also can put it out for other countries as information to them. And we can also look at how we can try and facilitate and help those of you who might not have come as far in trying to develop similar materials, both when it comes to the website, but also on thinking about how to work remotely, how to engage staff, how to engage with other actors, and also especially the phone interview part. I think is quite interesting to see how that will go, and it's great news that you managed to secure that amount of funds. We had, as is often the case, put in probably too much content for this webinar, so we have a little less time for some of the later elements of the webinar plans. What we will do, I think, is that we will just run through the elements very quickly, and then we can rather set up a second webinar that focuses more in detail on some of those elements, maybe following some more bilateral discussions with some of you. Before I do move on to the next, if there's one concrete question for Omar, I would like to allow that before we move on. Okay, so if you, I see Abarash, did you want to say something?
Yeah, can I ask Omar? Good afternoon, Omar. So my question is, we are requested now by officials to collect data on the effect of COVID-19 at district level. So how can your system help us, or how can we use your system in realization of that data collection?
Yeah, thank you, Abrash. My colleague, thankfully for us, we already had the shape files from all our districts, so we can pick up a conversation immediately after this call to see how we can support you. Our GIS guys may be willing to provide some insight on how we can go ahead with this. So we should be able to support you remotely.
I'm sure this would be very interesting for many other countries in this project as well. So maybe we can try and set up something that would also allow for others to benefit from that experience.
If I quickly jump in,
Yeah,
Rebecca,
go
on
ahead,
this,
Daniel.
Omar and Barash, yes, we have ways to work with this platform, and we are willing to also support this. That's one of the key reasons that we're putting this together. So the three of us can have a call and then see what can be done quickly.
Okay, thank you very much, Daniel.
Great. So
Okay, I have a question, Omar.
go ahead. Yes.
Okay, I just wanted to understand how they managed to collect the data from the households, considering that we have the outbreak is already like widespread in Ghana, and so how were they managing to get to households?
Yeah. So thank you. With the maps that I showed, it is not information we collected recently. It is the most recent household surveys we did in 2018 and 2019 that had information on hand washing and all that. And we realized that of course, the current circumstances means that people probably will change a bit. However, this will provide useful information on locations where many households do not really have water and soap for hand washing and other things, and even households that at least have one person who smokes cigarettes. We provided that. But what we are currently trying to do with the assessment is to use telephone interviews so that we do not have to go to households to have physical interviews, and that we hope to start it next week. And as Rebecca said, we'll be sharing, though it is still the concept note is in draft, I will share the concept note so that we can see what we actually intend to do. And we'll also share the questionnaire that we have currently. By close of today, we would have fine-tuned the questionnaire somehow, and we will share that with you.
Thank you very much, Omar. With this, I think we had two other topics that we wanted to touch upon, and I think I want to give Elena and Richard, who are introducing those topics, a chance to quickly run through them. And then we can really come back to them more in detail in a follow-up webinar or call. So Elena, maybe you want to go first on your element when it comes to ensuring continuity of key data collections.
Sure. Thank you, Rebecca. Good morning or good afternoon, good evening, everyone. Yes, so just to run quickly through this, basically this is an element of the email that Rebecca had sent, asking for detailed information from all of you. So we've put together some questions that would help us support you going forward in the COVID-19 response, but also, of course, in SDG monitoring. So you see on your screen some of the questions. We've discussed this a little bit here today. We've had an intervention from Jordan that I think brought up some of the issues that many NSOs are facing in terms of restrictions on the population, mobility that are affecting data collection and delivery of key statistical outputs and programs. And we've also heard that some countries are already starting, a great example from Omar from Ghana, on how the Ghana Statistical Service is innovating to kind of ensure the continuity of these key data collection and how to keep stakeholders informed. So because we don't have too much time, Rebecca, I think, had mentioned we'll have a separate kind of breakout webinars on these specific topics, but also it would be great if you could send us in writing, and I know some of you already have, and thank you very much for your responses, letting us know which key programs you expect that will be affected by the crisis, which kind of statistical activities, what you would need the most kind of support with, or the most ideas for how to innovate. And if you have already some programs or some activities, innovative activities in place in your country, please do share that with us, as well as with other project countries, and we'll of course add this to the UNSD COVID response page, and we'll have further discussions on this. And then if you could advance to the next slide, Farnell. And also, of course, since we are in this year, a lot of our countries are presenting their VNRs, and that, as we expect, will continue on the same timeline, at least so far. It's still planned for July. The high-level political forum might be taken online. There might be a format shift, but from what we know, we're still preparing the VNRs. So we would also like to know from you how we can provide specific support to you in the coming months to prepare for the VNR. And of course, for all of our countries, what you think we need to prioritize in terms of the SDG monitoring work moving forward. So these are just some questions for us all to consider. And we'll have further opportunities to share on this and to interact. And I guess this is just a starting point. And if you can provide some more of this information to us also in email exchange, then we'll know how to better structure the upcoming webinars. So if there's any questions on this.
Thank you very much, Elena. And yeah, I assume that for many of you, those especially who are not focused preparing their VNRs now, the SDGs are maybe fallen a little bit behind in focus. But in many ways, the SDGs are also very important to help us assess what the impact on the different aspects of life are from the COVID crisis. So my assumption is that moving forward, there will be a lot of questions from different actors on how or what the SDG indicators look like following the current situation. So we can set up something around that moving forward. I now also would like to hand over to Richard. He's our newest team member. He just joined us from ONS a few weeks ago. And he will talk with us more specifically on COVID response, particularly related to collaboration and user engagement. And I think this is also a topic that we could set up as a separate follow-up call, because there's a lot of things to discuss there and go more in detail on. Richard, go ahead.
Thanks very much. And hello, everyone. Very happy to be part of this project and to be meeting with lots of you for the first time. So I think the presentation we saw from Omar gave really excellent examples, both of collaboration and user engagement. And so for both of those topics, there's really a number of different angles that we need to be considering kind of at this time, kind of as we deal with COVID-19. And as Rebecca said, I think it'd be helpful to have a kind of separate session, separate WebEx, more specifically focused kind of on these topics, but just pick up a few high-level things right at this moment. So I think in terms of collaboration, as you've seen, some of you may be working with different line ministries as part of a COVID-19 response group, helping inform government's response by, for example, using existing data to show potential health, social and economic impacts in different areas and among different groups, or indeed providing entirely new data. And related to that, there may be opportunities to partner with government, civil society or commercial organisations in the creation of these new data sources and statistics, with these collaborations potentially focused around making use of new administrative or commercial data sources, the application of data science techniques, or the development of new dissemination platforms. Now, obviously, in delivering this type of collaborative work, there are, of course, challenges, many of which relate to the type of support that UNSD have already been provided in the start of the project. That as our circumstances change, the nature of that support kind of may potentially need to change to make sure that we're giving you the most relevant support we can at this moment in time. What would be really helpful, what type of support kind of you see as being priority right now. So the polling question, kind of, if you could bring that up, Faryar. Trying to understand what from UNSD would be most useful at this time, kind of on that, maybe around data collection and data exchange. So I think we heard earlier kind of about some of the challenges involved in moving surveys to kind of being able to work via telephone. How we could potentially offer support there, or kind of in data exchange. Obviously, may need to rapidly set up data sharing agreements. So there's kind of lots of challenges around data interoperability and integration, kind of where multiple data sources are being brought together, and I can also where we're actually either rapidly producing new statistics or kind of needing to deal with disruption to data collection. Kind of that brings lots of challenges around data quality. So if there's support that UNSD can provide in those circumstances, that would obviously be very helpful. And of course, we can also provide support on both data dissemination and user engagement. I think on user engagement, we have twin challenges at this time. It's periods where potentially there's a lot happening to our statistical systems which we need to engage users on. But obviously, with the restrictions in place, many of the traditional engagement activities are no longer appropriate, and also really may also be more challenging to reach out to some of our user groups. So if training kind of focus on user engagement, but how to kind of carry out develop strategies under the current circumstances would be helpful. Obviously, that'd be good to know. And I think we've got the polling results in. So we've got a kind of broad mixture of kind of different kind of responses from people. Kind of think data collection, kind of data exchange, kind of seems to be the one that's mentioned the most, and then user engagement. But we got responses across kind of all of the categories, so that's really helpful to know. And I think given the time, perhaps I'd leave things there, Rebecca, but as mentioned, we'll kind of come back to think about these issues around collaboration and user engagement, hopefully in a future WebEx in the not too distant future. Thank you very much.
Thank you very much, Richard. And yes, I think we can follow up with more webinars on various topics related to both SDGs and COVID-19. Sorry? Okay. So I think WebEx is going to cut us off quite soon. So please come back to us if you have any questions. Those of you who have not yet responded to the emails we sent out with questions on your current situation, your needs, etc., please do so. And we will also, if we have not yet done so, reach out to you to agree on calls, bilateral calls, so that we can get a better understanding and we have more of time to discuss with you concretely what your main current challenges are and where you would like to focus our joint work moving forward. It's also useful to hear whether you think these kinds of webinars are useful, what you would like to see more of. We would be happy to set up more of them. So please provide us with feedback generally on what you think would be useful. Maybe, Faryal, you could move to one of the last slides. I think it's the not the next one, but the one after. Faryal? There might be a delay. So we have been thinking a lot about what kind of remote support we could provide, and there is a variety of potential options. We could run workshops. We could provide you with more concrete e-learning so that your staff could sit and do e-learnings. We could do some more simple versions where we would do what is often called micro-learning, so videos on concrete topics. We could also potentially do something similar to what Omar mentioned that they had been doing in Ghana for ministries. So we are happy to try and adjust to the different needs and what you think would be most useful given your current and future situation. So let us know. We can do it either per email or chat or other opportunities. So I understand now that our manager of the session lost her internet connection, so we even have problems sometimes in New York. But overall, I think there is a lot of opportunities around this and a lot of ways that we can work together, both bilaterally but also across project countries. And I hope this was useful to you. I want to thank you all for joining us and looking forward to continued collaboration and experience sharing. Happy rest of the day or good night to those of you who joined us for a late evening. Thank you.
Just before you go.
Okay, go ahead.
I have a question for Omar. Is it okay if you could share your presentation, Omar, with us?
Okay, I do not have a prepared presentation. I was speaking from some notes I've just scribbled on paper. However, I would be sharing virtually all the information I have provided with UNSD, who will eventually share with everyone.
Thank you so much, Omar. And we would also, if you agree, be happy to put that on the COVID response page, but we can follow up with you on that bilaterally as well.
All right, that's fine.
Thank you very much to everyone. Thank you for joining and looking forward to working more with you, although this is a different way that we had planned for originally. Bye-bye.
Thank you. Bye.
Thank you. Bye-bye.
Bye-bye. Thank you.
especially COVID.